Hello, everybody. My name is Revati Raja. My colleague is Renuka Gune. We work at Trijog, which is an organization based in Mumbai. And we're going to talk to you about intervention and basically assessment in intervention.
Hi, everybody. I hope you are all safe, are at home. I hope all your loved ones are safe. I am Renuka Gune. I am an applied psychologist with a specialization in clinical, and I work specifically with children and adolescents in a center in Pvt in Mumbai, India, called Trijog-Know Your Mind. And we are specifically going to be talking about assessments in autism today. Let me just run you through the key points that we'll be touching up upon. Firstly, we are going to be working with assessments and screening tools used to diagnose autism and screen for autism. The second would be psychological and psychoeducational evaluations for individuals on the spectrum. Here, we are specifically going to look at when other psychological assessments, such as IQ tests or psychoeducational batteries or projective assessments, are then used to help us gain a better understanding of children on the spectrum or adolescents on the spectrum, and what are the various kinds of provisions and what are the kind of things that a clinician needs to be careful about when we are using these assessments and evaluations specifically. The third and the most important part that we are going to be touching up upon is in therapy assessment tools, which is the assessment tools and the screenings that we will be doing when the child is in therapy. This is specifically for progress monitoring, but it also helps us understand more about the lags. It helps us understand what would be the preferred way of going about therapy, what are the small changes that can be brought about in therapy, which is extreme about interventions. So, a child starts showing signs of autism at a very young age, depending upon how prominent those signs are. An average age during which a child tends to get diagnosed is about 4.5 years, right? But there have been diagnoses that have happened way earlier than that, say at the age of 15 months and 18 months. Now, of course, the signs and symptoms of autism in that case are very prominent and can be noted and noticed very quickly. But the assessment and screening procedure for autism specifically begins way before the child or the parent even steps into a psychologist or a pediatrician's room. It starts at home, which we call as developmental monitoring. Developmental monitoring is basically a process for us to check if there are any developmental lags or difficulties that a child has faced in achieving milestones, right? So say for example the child is already say 3 years old but is unable to walk, or say the child is now 4 or 5 but speech hasn't developed appropriately, right? These are all developmental lags that a parent would first start noticing and would bring to notice. Now again, who would be noticing these developmental lags would be parents, caregivers, teachers, grandparents, nurses, doctors, anybody who comes in regular contact with the child and is aware about the normative milestones that a child reaches. So to do this, genuinely you just need a developmental checklist. You can run that checklist and keep an eye on the lags and then understand where your child is at. Of course, all of these developmental lags, once you start noticing them or once you realize, oh, there is a certain area in which my child hasn't reached the potential or hasn't reached the level that he should for his or her own age, at that point you take them for a developmental screening, right? The difference between a screening and a diagnostic process specifically is a screening process happens when we are trying to see what it is, when we are trying to notice and gain as much as information as possible. We are trying to observe, we are trying to collect data and see where the lags are at. Diagnostic procedures are when we are collecting data specifically based on a diagnostic criteria, right? So here we are going to look at developmental screening tools that the pediatrician will take into consideration. Okay, so you notice that there are lags in the child, you take them to a pediatrician. The pediatrician will then run developmental screening tools to see if there are any lags, what are the lags that are present. And to do this, they will use two methodology, right? Either a physiological methodology or psychological methodology. A physiological methodology will include if are there any physical deficits that are present. Are the gross motor skills and fine motor skills, developing appropriately? Is the child able to do is able to do the physiological functions that are required? Is pincer grasp developed? For this, they might either use screening tools or such as paper pencil test, but they also, if they see lags, they might also go for major tests such as an EEG or an MRI if they are seeing lags, just to gain more information. The other psychological tests would then include: is the child's speech developing properly, communication skills developing properly, is there behavioral concerns present, right? And to do this, a psychologist, a clinician would then use two methods, either a direct method or an indirect method. A direct method includes the child and the therapist, or the child and the clinicians having a direct interaction with each other. This probably and most likely includes the therapist observing the child in real life, right? With a lot of playway methods, interacting with the child, trying to understand the lags, and trying to gain a better understanding. Indirect methods would include the therapist or the clinician talking to the parents or the caregivers or the doctors or the teachers, anybody who comes in regular contact with the child, to gain as much as data from them as possible, right? An ideal assessment tool would include both methods being used, a direct assessment as well as an indirect assessment, right? To gain a better understanding of the child. Let's move forward and understand what are the screening tools that are actually used. But before we go about that, we need to understand that screening tools are to gain more data. Diagnostic tools are for us to understand what is diagnostically the issue, what is exactly precisely the issue that the child is facing. But both of these techniques do not stand alone. When we are screening a child, there is more to it than just the tool that we use. It includes an history. It includes understanding of concerns that the child's sibling has. For example, the child is more likely to have or experience symptoms of autism if their sibling has same concerns, right? The likelihood increases. Or if there are neurological deficits in the family. So we need to have a thorough understanding of the history, thorough understanding of the milestones, the history of the child, especially what happened during pregnancy, what was that period like. We need to have an overall understanding. And then we can developmental screening tools to gain more understanding in a formal manner, right? To use more systematized normative tools to gain data. Okay, let's start with the first tool, which is the CARS-2. The Childhood Autism Rating Scale is one of the most widely used rating scales for autism, screening tools for autism, and it is currently in its second edition right now, right? So the CARS-1, it had its own lags, it had its own concerns in terms of it was not able to accurately pick out or identify signs of autism in those that would be considered to be high functioning children, right? They were not able to do that. That was one of the criticism that CARS had. But one of the biggest problems that CARS actually went through was a misadministration of the test itself. So though this test is supposed to be used by clinicians for observational purposes, what used to happen in real life is that this test was used basically as a rating scale for parents. So the clinician would just give this test out to the parents and ask them to fill it up, which is not how it was supposed to be administered in the first place. So then they came up with the CARS-2. Now CARS-2 is a test is very similar to the CARS. How they modified it is they added two levels to it: CARS-2 ST, which is CARS-2 standard, and CARS-2 HF, which is CARS-2 high functioning, right? So when a clinician meets a child, they will first evaluate the child's IQ based on clinical judgments, and then they will evaluate if the child's IQ is above 80, right? So if it's below 79, they are going to use cars to standard, and if it is above 80, they are going to use cars to high functioning. Now, how both of them differentiate mainly? Cars to HF is basically designed to identify more subtle signs of autism, right? And this would include um, lags in communication or communication impairment, right? And while a child with IQ 80 or higher would then have fluent communication, who has fluent communication, on those children we would be using the cars to HF. Okay, so just to run you through, cars to standard would be for 79 IQ or lower with impairment in communication, and cars to HF will be for IQ 80 or higher with fluent communication, right? Let's move on to GARS. GARS is a very beautiful test because it is unique in its perspective. GARS 3 is the Gilliam Autism Rating Scale, which is currently in its third edition. It is one of the most widely used instruments for assessment in autism disorders. Okay, it assists teachers, parents, clinicians. The unique perspective is it takes data based on the diagnostic criteria. So let me explain how it would differentiate from a cars 2. A cars 2, what it does, it collects data. It collects as many observational pieces in a formal manner as possible. And then you have all of this data, and then you have the DSM-5 criteria. And then you try to match whatever you have collected on the cars 2 based on the diagnostic criteria, right? On the other hand, what GARS 3 does is it will collect data based on the diagnostic criteria. So, for example, if the diagnostic criteria is impairment in communication, it's going to understand what impairment in communication is meant in the DSM-5 criteria, break it down into questions, and ask exactly those questions to the parents, right? So, this is a very simplified diagnostic tool wherein you are collecting data based on the diagnosis and the diagnostic criteria of DSM-5. Now, why that is important is because Autism Spectrum in itself has come through a massive change through all of the DSM-5 editions, from inclusion of Asperger's to the changes in Rett's to overall understanding of what autism is. It being a spectrum disorder, it is still in a transition of sorts throughout its editions. So GARS 3 has a very unique perspective on it. The next one is the Mchat. The Mchat is a developmental test again, but it is very, 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 very sensitive. So its goal, so the people who made Mchat, their primary goal itself was to maximum sensitivity, which would mean that they want to detect as many cases of ASD as possible, right? But though that's a good thing, what that happens is there is again a high false positive rate, right? So children who are just showing maybe a few signs that are similar to autism will be detected to be at risk for autism, right? So not all children who score at risk will be diagnosed with ASD, right? So what they did was, so in the second stage, Mchat revised, what they did was they added a follow-up, which is now known as Mchat R/F, Mchat revised follow-up. So even with the follow-up, so for example, you do the Mchat R, you see that the child has been rated at risk or the score is higher. You say, okay, now I'm going to give the follow-up questions, right? Now, even with the follow-up questions, a significant number of children who screen positive on the Mchat R will not be diagnosed with ASD. However, these children are at high risk for other developmental disorders or delays, right? So, an evaluation is warranted for any child who screens positive. Okay, so that is extremely essential. So, if the child is showing positive signs on the Mchat, further assessment and evaluation is necessary, especially on the follow-up questions, right? Mchat is sensitive towards ASD, but that does not mean Mchat is the only thing that can be used to diagnose ASD. Now let's move on to other screening tools and tests. First of all is the ages and stages questionnaire, right? This is a general developmental screening tools that the parent completes. It has 19 very age specific questions, right? Which screen from gross motor skills, fine motor skills, problem solving, personal adaptive skills, right, and takes an overall understanding. Then is the CSBS, also known as the Communication and Symbolic Behavioral Scale, right? This is it measures up the symbolic abilities only up to the 24-month level, so it's unique in that perspective, and it's only for infant and toddler checklist. Next would be the PEDS. It's the Parents Evaluation of Developmental Status. This is a very general developmental screening tool. Again, it's in a parent interview format, and it measures developmental and behavioral problems that need further evaluations, right? So it is generally when you're especially using the PEDS, I think it's much more useful as a surveillance tool to understand what is happening rather than a screening tool as such, just to have a general understanding of what is the child going through, what are the issues that the child is facing, through the format that the PEDS has created, which is again very beautiful. Again, we are running through these other developmental screening tools, but you can gain much more information about these tools and assessments online. Next is the screening tool for autism in toddlers and young children, also known as the STAT. Now, the STAT is very fun because it is an interactive screening tool, right? So, children who are then suspected of developmental concerns, we can use the STAT with them, and it consists of 12 activities, right? So, the best way to interact with the child, to have fun with the child, to observe as much as you can with the child is in a playway method, where the child is interacting with you, the child is having fun while doing this with you, and you are having fun with the child. And that increases the chances of you observing as many behaviors as you can, right? And you can do this, you can just play with the child in a more structured method to observe data, to observe more information about the child. So it has 12 activities, all that are assessing play, communication, imitation skills. And the best part about all of this is it takes about only 20 minutes to administer, right? So as much as your assessment tools are activity based, especially with young children, it's more beautiful. Not only does it help you to develop rapport and to understand what is going on, but it's also fun for the child and more interactive. Okay, next is the Eidos. Eidos is something that is very it's a standardized diagnostic test for ASD. Okay, it is again published by the Western Psychological Services. The unique thing about Eidos is now it's available in 15 different languages, which is really beneficial. It's again used in multiple setups. It's used in school systems, it's used by clinicians, again to screen for developmental disabilities. Okay, now when we are talking about again the ISA, the Indian Scale for Assessment of Autism, is also a brilliant scale to use for children, to use for adults as well. It's specifically normed for the Indian audience, for the Indian population. So it is a really useful tool to be used, and it has a really good standard and normative base as well. Again, ISA is also a direct and an indirect tool, both. Now, when we know that when we do all of these screening tests, it becomes obvious, right, that a child on the spectrum tends to have a few common difficulties, right? That may include language deficits, joint attention deficits, behavioral difficulties, sustained attention difficulties, right? Now, all of these are something that they find more difficult than other children of their age, right? And this therefore affects each and every part of their life. This also affects in case they have to undergo any other standardized psychological testing. Say, for example, an IQ test, a projective test, a psychoeducational eval, right? Now, when a child on the spectrum needs to undergo any other psychological assessment or a psychoeducational assessment, the clinician needs to be extremely careful. First, we need to understand as clinicians, why are we doing it? Why is an IQ test being administered? What would it be used for? What do they need to know? Because at that point, we need to gain as much as information as we can. Now, let me tell you what are the difficulties that a child might face, right? First, let's look at the language deficits that most children face on ASD. Now, this may include delayed speech and language skills, um, or in general, verbal language proficiency should always be considered when completing standardized testing, right? Because this might include understanding of directions. This might include them not understanding pragmatic language, right? Like idioms or sarcasm, all of those things. Now, when we take that and let's say an IQ test such as the WISC 4, right? Their performance on vocabulary, similarities, general comprehension, general information, subtests such as this might be limited. Not because they don't have the answers for you, but because their verbal language proficiency might not have been developed to what the WISC 4 expects, right? Or say, for example, small tests such as the sub test of antonyms on the WG, on the Woodcock Johnson, right? That is a subtest that they might find significantly difficult to understand and go through. And so we need to be very careful while administering these tests or understanding why we are administering these tests by taking into consideration the lags that a child might face. Next are joint attention deficits, right? Joint attention is the ability of an individual to share interest in an object or event with someone else. Like, if they have to look at pictures and look at manipulative pictures, right? And sometimes they might not understand how to do with the task. For example, let's take into thematic apperception test, okay, or children's apperception test. The CAT and TAT are again projective test. Abstract reasoning and joint attention deficits, very difficult for a child to actually imply and project their emotions onto another, project their emotions out there, right? So even when we are using projective tests, so there are a lot of research that goes into it, but again, we need to be very careful when we are using projective tests. First of all, why are we using it? Is there any alternative, right? Next is behavioral difficulties. Now, individuals on the spectrum are at an increased risk to engage in disruptive behaviors, right? This might be specifically stereotyped or repetitive behaviors, or it may be difficulties because of stress and anxiety. It might, so because of all of these things, they might have a hard time participating in standardized testing, right? And therefore we need to be extremely careful. Now, simple things such as, if you decide to do, okay, I need to measure a child's IQ and I'm going to do a segment form board test, sanguine form board test, right? Now, if you decide to do SFB, that's fine. It's a performance test. Verbal language deficits will not be a component there. But what if the child is then indulging in repetitive or restrictive behaviors? Trying to put in the star appropriately, needs to tap down the star about 3 to 4 times till it fits properly, right? Or I had a child for testing who then would take a piece of block and try to fit it, though he would know where the rectangle goes, but he would try to fit it in everything and then would put it where it's supposed to go. Now, that is a restrictive behavior that the child was displaying at that point, right? And then we need to be aware of that is definitely going to impact the time. When the time gets impacted, definitely is going to impact the overall IQ score. So, are we taking into consideration these behavioral difficulties that a child might face? Second is sustained attention, right? If the activities are not of interest to them, they are not going to be able to perform appropriately, especially tests that have a time limit, right? You will see them probably in reading fluency on the WG, on the Woodcock Johnson, or you will see if you are using the WISC performance test of Mahendrika Bhatt, you will see them in a lot of performance tests, right? Even the math problems on the RAT, right? All of these things you need to be very careful while you are administering. So let's look at what we can do rather than what we need to be careful about. Let's look at what we can do, right? What are the modifications that a psychologist can make to accommodate students with ASD? First, what we can do is allow time for rapport building, right? talk about their interests, engage in a preferred activity, help them become more comfortable around you. Now, we do this with almost every child. Rapport building is a very important process of testing in itself. We need to have a significant rapport that is being built before we start the testing procedure. But with children with ASD, being a little more interested in their activities, being a little more informal, being like communicating with them much more, definitely helps. Second is use nonverbal measures whenever and wherever appropriate. If you find a nonverbal alternative for a test, use it, right? Even if the child is fluent in communication, even then there is a high chance that they might not be able to understand pragmatic language communication, such as sarcasm, right? Don't use, if you have alternative of a non-verbal test, don't use the verbal tests, right? There are a lot of neuropsychological tests that are available in a non-verbal format, right? Try to use them as much as possible. Adjust the environment. Now, adjusting the environment might also include simple things such as sensory deficits, sensory concerns that the child is facing, right? If they have an access to preferred seating, make that available. If they require fidget toys, make that available. Also be aware if the child is used to certain type of reinforcements, right? Now, we don't need to provide reinforcements or verbal reinforcements saying, oh my god, you did such a good job, to answers, right? We don't need to reinforce their answers, but we can definitely reinforce their behavior by giving them more time to play. We can give them more frequent breaks in the middle. We can allow them time to rest, things like that. We can, to help them understand what the procedure goes like, you can also have a visual schedule, right? To see how many activities that they have to do, what's left for the testing to be completed, just so that they have a more predictability about the future and lack of ambiguity, right? Use as many positive reinforcements as you can. Okay. After all of this, when you get the test results, be very careful while evaluating these test results. When you are evaluating these results, you need to take into consideration the deficits and the delays and the issues that the child is facing because the child is on the spectrum, right? And how that could have impacted the testing and further impacted the scores. Whenever possible, or in general, take feedback from the parents, the teachers about the concerns why you are evaluating the child, right? So have a global and more dynamic approach towards testing rather than just relying on the scores and assessments. Once you have the data from all of the test scores, we need to further understand what we can do with the tests, right? What are we going to do with the information that we have collected? Most likely, when we see delays or when we see concerns, it means that we need to further use use this information in a therapeutic point of view. Use them in therapy to understand what are the differences that we can make, what are the changes that we can make, and how we can help the child become more functional. So the assessment styles that can be used in therapy will be further explained by my colleague Revati. And if you have any questions once Revati is done, we would be addressing them. Thank you.
All right. So Renuka just spoke to you about basically the um, what kind of diagnosis, what kind of screening tools that we can use. Definitely, please ask questions about things that you might not have understood. We can get back to you a little later to explain a little further on those things. So now I'm going to be talking about basically 5 assessments that is used during therapy. So of course, therapy for autism is not just to do with behavior. It's also to do with speech and language pathology. It's also to do with occupational therapy. It's an all-round, thing. You have to work with multiple levels in order for us to be able to help the child function at the level that we want to get them to. But I'll be talking to you about more the behavioral aspects of therapy, and therefore the assessments used in the same. So the basic language assessment is the one that is done for is used as a pre-screening tool. This I will talk about each of these further, but let me just go through what all I'm going to be talking about first. I'll also be talking about the preference assessment, which basically talks to you about the potential reinforcers for intervention while you're working with the children. The functional behavioral assessment is the third assessment. This one basically is helps us understand what the core functions of behavior are that might be causing or sustaining a particular behavior, and therefore what kind of intervention would work best for that particular child. Then comes the assessment of basic language and learning skills, which is the ABLS, and the which identifies deficiencies and understands what levels we're supposed to be working on and what would be helping the child master their the skills that they're missing out on at that point. And the verbal behavior milestone assessment and placement program, which is the one that is the most recently developed assessment, and a lot of people are right now talking a lot about it. So ABLS and VBMap are the ones that are used most in during intervention. And yeah, let's move on. Right. So the basic language assessment, it's the screening tool which determines where the language program should begin for the child. So the assessment parameters for this particular assessment are how the child cooperates with the parents, whether the child is able to demand, which is basically request for items, if the child is able to imitate, not just imitate vocally, but verbally as well. It also looks at vocal play. It looks at receptive. Receptive here means when a child is able to understand the instructions given and actually do it. So that becomes an important part in teaching, when a child is able to comprehend and carry out instructions. Then there is labeling, which is also called tacting. It's being able to tact, which means name particular things. So when you present a particular item like this, the child is able to say that it's a pencil or a pen. Then there is the conversation, which is also called intraverbals, which is being able to like fill in the blanks, or when you say what's your name, being able to answer with your name. So if somebody asks me what's my name, I'd say Revati. If the child is able to answer questions, be able to do that interaction of verbal interactions. Then the BLA also talks to you, assesses letters and numbers and social interactions that the child is able to do at that particular level. This gives a basic, it's a very basic assessment, so it gives you a basic understanding of where you want to start from when you are creating intervention, a behavioral intervention plan for your child or for the child you're working with. The next is the preference assessment. So preference assessment is very, very important when you're working with a child who is on the spectrum, because reinforcers are extremely important. It helps the child feel motivated and move towards the task that we want to teach them. So the preference assessment basically is conducted to identify potential reinforcers. Now, remember that just because a child likes a particular thing doesn't mean that they will use it or will be ready to work for it at any point of time. So it depends. So if the child has just eaten food, probably food is not going to, even chocolates might not be something that the child will want to be, working for. A toy might be a better idea. So understanding what are the different kinds of reinforcers that will work for your child, and then deciding later how and where you can use these reinforcers becomes really important. Now, how do we find out, how do we do the preference assessment? Here, there are basically two ways in which to do it. One is the operant observation, where we basically allow the child to play. We put them into a room and allow them to have free access to any toy or anything in that room. And therefore, you kind of start noting down what is it the child gravitates towards most when playing. This is of two types, the operant observation. One is contrived, which means that if it's happening outside the house, it's not the naturalistic environment, it is happening at a therapy room, the therapist would probably put into place the kind of toys that they have, and then therefore decide what are the things that the child is excited by or is interested towards. And the contrived one is in the therapy room. Whereas there are also sessions that happen in the house, so that the child the therapist might be at home, or the parents also could do this, where they check in the naturalistic environment what are the things that the child is going towards. Therefore you make a list and you kind of order it according to the amount of time, or the number of times the child goes to that particular item, or the amount of time the child plays with that particular item. So this becomes an important way in which to gain potential reinforcers. Now the other way is the trial based methods. So this is basically, you kind of allow the child to look at only one particular stimulus. So this is divided into three types, where basically it is the single stimulus, which is also called the successive method, which is where you basically give the child a particular, or the person, a particular stimulus. So if you give him a pen or a pencil, and then you note whether the child or the person individual takes it, or is interested by it. Once that is done, you go on and you move on and you give them something else. And successively like this, you allow the child or the person, the therapist notes down what it is that the person is feeling towards that particular stimulus. Then there is the paired stimulus, which is also called the forced choice, which means that you present two items to the person, and you you kind of record the data of how many times a particular item was chosen, and these items are then put into rank order. This method takes the most time because it is, but it is also said to be the most accurate, because when there are only two things the child is forced to choose between, you kind of understand how many times the child goes back to a particular thing that they like. Then there's the multiple stimuli, in which various items are given to at a particular time. There are two variations of this. One is the multiple stimuli with replacement, and the multiple stimuli without replacement. The multiple stimuli with replacement, it kind of, you will give a number of items as together, and then when some items are not chosen, you replace those items with other items, and therefore you start putting down and noting down what are the items that were not taken, what are the items that were taken, how long the child played with a particular item, and therefore you understand the interest level of the child in that particular item. Then there is the without replacement one. So if the child, the number of items that you have presented to the child starts to decrease, because you start taking away the ones that the child does not play with, and then it goes down to basically just one in the end. But of all of these methods, the one that is the quickest is the multiple stimuli without replacement. Uh, Now we go to the next one, the FPA. The functional behavior assessment is very important, like the preference assessment as well, because we understand what the reason for a particular behavior is. So there are four functions of behavior. Of course, they can occur together as well, but it is easy for us to understand when we are able to look at a particular behavior, and then after gaining information, understand what is the reason for a particular behavior occurring. So the four functions of behavior are sensory, escape, avoidance, and tangible, right? So if the child is doing things that are automatic in nature. For example, when you see the hand flapping behaviors or the head banging behaviors, even grinding of teeth, all of these are automatic reinforcers. There's nothing from the outside that is allowing or making the child do this, right? Then there is the escape. When a particular demand is placed on the child runs away from it. This kind of allows you to understand that the reason why the screaming or the hitting or the any of these behaviors occur is because they want to run away from something rather than anything else. Another way is the tangible. So when tangible means wanting something, that gaining a particular a thing that they can hold or play with, or something that they want. So if a particular behavior is occurring for in order to get a tangible, then you know that you have to act in a certain way in order for the child to change that behavior. And A stands for attention. I'm sorry, I said something else in the beginning. But attention is basically the child is showing a particular behavior in order to gain attention of uh, gain your attention in order to get something. So understanding these functions of behavior decides how we are going to intervene for the behavior, and becomes extremely important, as I said before. Now, the two things that kind of go are similar but different are Abels and VBMap. So the difference between Abels and VBMap, to just be very clear, is basically both are very good assessments and are used by various people all over the world. Um, it is used especially with applied behavioral analysis. So board certified behavior analysts are the ones that use it very often in order to work with the children. Um, so the difference between Abels and VBMap is that Abels is not developmentally sequenced, whereas VBMap is developmentally based. So there is also the difference between the two is that the Abels, they don't have the barriers assessment or the transition assessment parts. So while you might be able to see Abels is extremely good in able to in helping us be able to track what kind of information a child I'm sorry, what kind of growth the child is showing in a particular goal that has been set. VBMap allows you to understand why a particular goal is not being reached. What are the reasons? What are the barriers in which is causing the child to not reach the goals that have been set for them? So, as written in this slide, you can see that the function of this test is in order to identify deficiencies in language, academics, self-help, motor skills, and then implement, monitor, and create individualized interventions for the child. The assessment basically looks at MAN, STAPS, interverbals, echoics, writing, spelling, and grammar when it's doing its assessment. Um, and Yeah, so that's basically Abels. You'll have to Abels, and VBMap has a lot of information in it. So we'll have to do, like, it can go on for 2 hours if I start talking about one particular thing. Now, VBMap is divided into 5 parts. It has the milestones assessment, which basically goes through what are the skills that the child should be having right now, and what are the lags that the child is showing at this point of time. It was created using both field testing on both typically developing children as well as children who have ASD, and therefore can be very well. It goes through the milestones really well, and it's actually easier to assess or easier to use than the Abels when we learn to do it. So the milestones assessment goes up to 48 months. Of course, if the child has major lags, it can be used for an older age group, but it has the milestones in it are for 48 months. The barriers assessments focuses on learning and language impediments that may prevent the child from mastering the new skills. There are 24 parts of that, and it can be it can be really helpful. Then there is the transition assessment, which basically when a child is able to, it assesses whether the child is able to move to a new skill, or when has mastered, and whether it's ready for the transition to learning the next level of that skill. The task analysis, it helps you understand what are the skills that need to be learned in order for the child to reach the milestones that are in this guide, right? So there might be skills that the child has not yet mastered, because of which the child is not able to reach those milestones, and the task analysis and skills tracking helps us understand that. Then the placement and IEP goals. This helps us once we have gone through all these other parts of the assessing. We are able to put into place the individualized educational plan, and therefore decide what level and where we want to head towards with this child. So the function of this assessment is to evaluate the children with autism or other developmental disabilities and assess their current language and social skills, identifying impediments to learning, analyzing needs, and guiding curriculum, and of course tracking growth. So those were the five assessments that are being used right now quite a bit all over the world. And I guess if you want to ask any questions, we are ready for that. We're done with the rest of it. Right. Okay. I think the most latest question that came was, which do you prefer, Ables or VBMap, which is quicker to administer? Both take time. I think Ables is quicker to administer, but I prefer VBMap because I think that it gives me a much better understanding of uh, what the problems are and how I can work towards getting it better. Right. Okay, there is a lot. There is lots of technical information. Can you help with some practical example? Okay, Leila, could you tell me what kind of practical example that you would like? Then I could give you that example. Basic test we can use in school premises. I think the ABLES is a good test to use in the school premises if you're talking about intervention, because it also works. ABLES goes more into the academic part of it than VBMap does. VBMap does works more on the other skills. It does, of course, go a little bit into the educational part, but ABLES goes into education more. So in the school premises, it would be, I think, Eidos. Uh, how often is preference assessment done? Preference assessment is usually done in the beginning of the therapy interventions, and then again when the child starts to develop. You as all children start to change the kind of things that they like and what the things that they dislike, and sometimes using too much of the same reinforcer can actually cause the child to stop liking it. So you might, after about 3 months, about 6 months, you might have to redo a preference assessment because the child has grown, has got more interests, and we might be able to help them better. How do you select, Rekha? Your next question was, how do you select items in the preference assessment? You have to basically understand the child. So do interviews with the parents. If you're a parent, then you know the things that the child works with. So what a preference assessment does is gives you a more precise understanding of what can be used, rather than just guesses. Yeah, so there's no list or a kit. It depends on your individual child that you're working with. Uh, the minimum amount of sessions that might be required to complete a language assessment. That's another question from Donna. It really depends on the child that you're working with, and it depends on uh, how deep you're going in the assessment. If you're doing the BLA, it might be, and it also depends on how old the child is. So really, it could take a couple of hours, it could take a couple of days. It depends on whether the child is able to connect with you, when if you're going to be doing it via observation. It depends on the child. Okay, I'm reading Poojan's question. Under basic language, able to hear, see also when she looks, and understand, but not able to act upon it when asked for it. I'm sorry, I didn't understand that question, Poojan. If you could write it again, I could maybe explain it better. Uh, okay, I'm going to check if there are any other questions. So the question is autism curable with therapies only? So in my opinion, I'm not sure whether I would use the word cure. I would say that we can help the child be able to adjust and function in society to the level that they are able to do. So these therapies basically understand what are the lags that the child has, and therefore helps the child be able to function better. So behavior therapy works pretty well, but there's also so many other therapies that are being used right now that a lot of people say work. So like music therapy and all of the other kinds, play therapy and things like that. So but therapy definitely is important for a child who has autism. Without therapy, it could be very, very difficult for anything to work with the child. Who's the right person to administer these tests? Important question. The right person to administer these tests are people who have experience and who have the education too. So we have to have somebody who has actually, these tests are easy and difficult. So you have to be able to have learned how to administer these tests, have somebody who has watched you do it, and so that you know what you're doing and what are you assessing. So basically psychologists, and anybody who has studied applied behavioral analysis, those would be the people who can actually do the test. Could you please specify the full form of ST in cars? I think it's standard. Standard, yes. ST in cars is standard. And the other one was HF. High functioning. Right. So the one was ST was standard, and the HF in cars is high functioning. What about the ISA scale? Does it help in more accurate screening of Indian population? Renuka? ISA scale is again a test that is again a screening tool that has been normed and validated of the Indian population. So it is a brilliant scale to use. It is really good, but again, very restrictive to the Indian population. So to gain more information and to have a better understanding about the child's deficits, ISA is a really good way to go, but only for the Indian population. It hasn't been normed for anyone else. Yes. So your answer, Rashmi, is yes, it is more accurate for screening of Indian population. Is CARS better or ISA? Is CARS better or ISA? CARS definitely. So the thing is, CARS will give you a face-to-face interaction that is in a more structured format. Again, it's about you choosing an approach. Are you choosing a more directive approach, or are you choosing a more indirective approach? Right? Both of the things are going to measure almost the same concern. I think CARS has a few broader approach towards the concern as compared to ISA, but the only difference is ISA is an indirect approach, CARS is more of a direct approach. So if I hope you heard what Renuka said, but for the question, is CARS better or ISA? Renuka said that CARS is a direct approach, so you are able to see the child and watch and then decide on things, whereas ISA is an indirect approach. So it depends on the kind of approach that you are using, but she prefers CARS. Okay, my son went through psychological assessment 6 months ago. Now he is 3.5. The VSMS interpretation was borderline delay in social and adaptive skills. Does it define autism? No. It does not define autism. You will need to do more assessment. More information. More information, definitely. Sorry, Renuka, you said something? Yeah, we would need more information as to what was conducted, what were the behaviors, history. Again, assessments are not a standalone diagnostic tool, right? We need a lot more information than just what the scores say. So just with the VSMS, a diagnosis cannot happen. You need to be having various other things, an interview, maybe ISA or CARS. You need to get more information in order for a diagnosis. So definitely go in for more assessments in order to understand whether the diagnosis is there. How do you get trained in learning VBMap? There are You can go online. There are places that are teaching it online right now. I actually, while I was studying it, I had a supervisor who taught me how to do it, so that helped me. But there are things online who are teaching you both ABLES and VBMap. While I was doing some research, I did see. So maybe you can, if you just go online and read, you will find online teaching for this. Okay, four functions of behavior that I mentioned was sensory or automatic, escape, attention, and in order to gain a tangible. So the way that I remember it is SEAT, seat. So sensory, escape, attention, and tangible. You can buy this online. I got my VBMap from Amazon. I don't have Able, but the school that I work at does have Able, so you can buy it online. Uh, can a speech therapist use and administer VBMap and ABLES? I think if you learn the test, you'll be able to administer it. But I would, I'm not completely sure about it. You will need to learn, read a little bit about it. I'm sure you'll find it online if you go online. Please show video with one part of assessment in future that will be more useful. I understand that, Krupa. Would love to do that, but we only had a limited amount of time in order for us to be able to do it. So if we had put in some videos, we would have really gone off time, but definitely we'll keep that in mind. How long or how many sessions do you take to plan a program, and how do you record the session? Okay. How long or how many sessions do you take to plan a program? The program planning can take up to a week, maybe more, depending on the amount of number of assessments, the child's mood, behavior, the ability to get the right kind of interviews done. It could go up to a week for after the assessment for the interpretation to happen. So yeah, I would say about a week to plan a program, and then of course you have to keep changing the program as the child either is able to reach the goals or is not able to reach the goals, and therefore you have to change the way that you're doing it. So yeah, 1 week and then it's never ending. And how do you record the session? If you mean taking data, then you decide on what you're doing with the child, and depending on the kind of therapist you are, if you are an ABA therapist, you will have a lot of data taking and understanding of putting things down on paper. But other therapists also work and they do it with in paragraph formats every after every session, and or a little bit of understanding is written down on what was done, how it was done, and therefore, that's how you record the session. There are training programs for ABLES and for ABLES as well as for VBMap. You'll have to go and check it online. I'm sure I saw at least 2 such training programs. Yes, special educators can administer. From which age can we start these assessments? So the diagnosis of autism can happen as young as 2 years of age. So all of these assessments, so the VB map starts from 0 months onwards. Like you're looking at just looking at the youngest as you possibly can when you see the changes happening in the child. When you're working with the child, you know that there are some things when you're living with a child, you know that there are some things that child is not able to do that other children are able to do. So you can start as soon as the child is able to talk, or at least is supposed to be able to talk, or at least not even talk, is sorry the it's able to interact with you. That is what I mean. When the child is able to interact, you can start doing the assessment. uh, There are children where history shows normal milestone achievements till age of 2 years, but suddenly parents say that After that, they saw regression in the existing abilities. Uh, what might be the reason for that, and does any test take care of this regression thing? Uh, I don't know. Nobody knows why this happens. We know that it happens sometimes, but yeah, Renuka, you have an answer?
Also need to, so DSM-5 does not categorize this under the autism spectrum anymore, but we also need to look at RETs in that case, right? If there is a regression, I would highly suggest that at that point a neurological assessment take into consideration and EEG by a pediatrician. So though there are cases of regression that we see, are right now at this point more explainable with the help of neurological tests rather than psychological assessment. So I think, to understand in case there are any signs of, regression because of, say, seizures that are not visible, absent seizures, or something else that we might not be able to get. So start with the neurological approach. If nothing comes up, then go to a psychologist.
So, in case you can't hear Renuka, she says that there right at this point, when regression does occur at that age, if you're able to see signs of regression, doing MRIs, ECGs, these neurological tests are important in order to be able to check for silent seizures or things like that, and not psychological assessments at that point. There are no tests in order to stop it as of now, but at least you'll be able to see if there is something happening that you can do something about using neurological assessments at that point. So all of these assessments are done. So sorry, the question is, are there any tests for parents or questionnaires? So all of these tests are done with a parent involved, because we're looking at early intervention and children are not able to really answer for themselves. So parents are involved in coming to a diagnosis. There are questionnaires, there are things for the parent to answer. Like for cars and GARs, there is a parent side to it. So yeah, if the question is whether a parent can do the assessment, definitely if you are able to go and study it and learn it and then be able to conduct it on your child, then you can definitely do it. Rashmikant, we can talk about that later. Let me see if I can answer any of the other questions. So most of these assessments are the question is about whether mother tongue plays a role in assessment, especially when the child does not speak or understand English. Most of these assessments are done via observation and parent interviews. Renuka, do you want to try and answer this? Oh, you can't hear. Okay. So mother okay, mother tongue. Basically, since it's done with via observation and parent interviews, mother tongue, it does not play a role in early intervention. But when as the child grows up, you will be able to it will be taken into consideration when an assessment is done. These kind of assessments, when you're looking at an IQ test and things like that, things will be different. It will be a different kind of assessment that you will be using depending on the mother tongue. I think this is a question for Renuka. Any standard ASD scale that can be administered in only one visit?
So, can be administered in only one visit. GARS can be done in one visit. CARS can be done in one visit. ISA can be done in one visit. But there is currently no gold standard for test that exists. It is more of ASD diagnosis. The screening process heavily relies upon history. It relies upon understanding. It relies upon observation. So there is no gold standard, but there are a lot of tests that can be done in one visit.
So Renuka says GARS, CARS, and ISA are all tests that can be done in one visit, but only using that we cannot be certain of an ASD diagnosis. You need to do so many other things like observations, interviews, and all of that in order for the diagnosis to happen. So if the visit can span over a few hours, then maybe in one day or one visit you can uh, administer it. But there's no standard thing that can figure it out. One thing cannot figure it out. It has to be a combination. Uh, Somebody has asked for videos in context of assessment. If you all remember what the assessments are, you will definitely find videos of this on YouTube. I used it a lot when I was learning how to do it. It helped me observe. So definitely, if you go online, you will find it. Food is a good reinforcer, but it's a controversial reinforcer. So the problem is that because the child might get really excited about using food, but food is extremely difficult to fade away. So if the child has started to use food if you're using food as a reinforcement, you have to have a plan in mind on how you're going to fade that away and allow something else to become a reinforcer, because food cannot be a reinforcer for life. It has to be used very, very carefully if you're using food, and only if there now this is my opinion. I think you should use food only if you can't figure out anything else. If you can figure out anything else, you shouldn't use food. That's my opinion, but it depends on therapist to therapist. There are therapists who believe that food can be used and they are very good at fading it out, so it depends. Okay. If sensory is a function, why there are words like sensory issues and behavior issues the OT talk when they address the problem behaviors? A function meaning a function of behavior means that the reason for it. So even when an occupational therapist is talking about sensory issues and behavioral issues, they are just dividing it into two parts. What I have done is I've divided it into sensory issues and then into escape, attention, and tangible. So that's divided even further. So it's not different. It's different only in the vocabulary used. I hope that explains that. Um, Techniques to use with an adult, it depends on the therapist and it depends on what you're looking at. Even for vocational has to be done in so many different parts, that you need to be able to first assess what the level the adult is at, and what are the milestones that they have reached or not reached for the age that they are at, and what are the skills deficits that are causing the adult to not reach the goal or the task or the skill that you are trying to get the adult to get to. So it really depends on what you're working towards. Where can you get these assessments? As I answered before, you can get them on Amazon and various other places, both Eidos and VBMap. And Renuka is trying to.
They are mostly.
Sorry?
Like they can you come and take these, where they can come and take these tests, like they can come to Trijog. Is that what they're asking?
The question is, where can we get this assessment available? So, but if yeah, you can find all of these assessments online, including the ones that Renuka talked about. But you have to buy them. And if you want to if you want to get an assessment done, you need to go to a place, an organization that is doing the test, like the organization that Renuka and I work at, which is Trijog, where we do a lot of these assessments. Is it recommended? I'm sorry, I didn't understand the question. Is what recommended? Khadija? Khadija? A 1 minute talk about VBMap. Based on what? I'm sorry. I did talk a little bit about VBMap already, so you need to ask me a little more. Centers in Bangalore that do these assessments. I'm sorry, I don't know any right now, but if I do, I would definitely be willing to share that information. Uh, Sorry, I'm not sure. All of these assessments are taking into consideration, okay, the question is which is the best test for nonverbal autistic children. So I'm looking at it from my point of view. My answer is that all of them can be used because you're looking at the milestone, and one of the milestones is speech. So if the child is not talking, then it would still be there. There'll be other things that will be looked at. It does not have to be that the child has to speak in order for these assessments to be done. And the same for, I think, the ones that Renuka were talking about. Yes, Renuka? Yep.
Yeah.
Yeah.
Speech is just one component.
Speech is just one component. Do you have any information about medicine working on ASD? No. I am not a medical professional, so I won't be able to give you any answers on medicine. Sorry. The question is about behavior issues. A child who's intelligent but doesn't pay attention in class. You'll probably have to first do an assessment to see what the reasons for this behavior is, whether he has ADHD, whether he has any other kind of underlying causes that is causing it, or whether it's just a psychological issue, whether there are problems at home. We don't know what it is that is hampering his studies and why that is showing up as these behaviors in the school. What kind of therapy will work on him will only be decided once you are able to assess and understand why the behavior is occurring. So I won't be able to give you any information on that. So there's somebody here who says that they did an assessment when their child was 3 years old, but he's now 7, and there were no other assessments done. So I would think that maybe you need to go in for another assessment, and I hope that you are working on therapy for your child in order to work on the lags, delays that you say. Yes, Renuka?
Speak to your therapist. Speak to your therapist in terms of what.
Speak to your therapist in terms of what assessments can be done next at this age. A child who has been diagnosed with autism can function. We can just help them function as typically as possible in order for them to be able to live life in society. The whole the whole goal of therapy is to help a child or an adult be able to function in society to their best abilities. Right? I'm not sure. I would not be able to commit to saying there's a cure for autism. Okay. Uh, I'm not sure what the question is. My my child is 3.5. When we make him see pictures of our parents, he understands that it is our photo. But when I ask him to show us, he laughs. He makes faces. He understands it, but he does not show it or point it. For example, if we put A and B in front, he will show uh, which is A and B out 5 out of 1 times right when he picks up. Okay. If a child with, I'm sorry, I did not understand the question. I hope whoever put that up can give me the question. Uh, if a child with autism has additional abilities, which assessments need to be done? Additional disabilities. For example, deafness, blindness, which assessments need to be done?
In that case, indirect assessments would be the way to.
So in that case, indirect assessments would be the way to go in that case. Are there any questionnaires given to parents to monitor child at home? Depends on the therapy, depends on the therapist. So there are assessments, I mean, there are questionnaires that can be given and are given, but it depends on what kind of therapy you're doing and who your therapist is. And if there is a need for it. With the help of speech therapies, how long will it take for my 2-year-old son to learn to speak? It depends from child to child. There is no, I won't be able to give you, neither of us will be able to give you a proper time or, a timeline. It depends from child to child. It depends on what kind of therapies you're doing, whether you're doing, if it's also with speech, if the child has other kind of issues, like if they have some sensory problems, whether they have behavioral problems, how all of these things work together to help the child. But there is no timeline for when a child will begin to speak when you're working on them or with them. For a child with ASD with above average cognitive abilities in a regular school setting, how can she be helped with peer interaction and socialization? You need to speak to the therapist that you are working with, because it depends on your child. It depends on the what average cognitive ability means for your child. It depends on the kind of interactions, social interactions she's able to already do. So really, you'll have to talk to the therapist that you are working with, and or the school counselor, the person in school that is helping you. Is it advisable to do these psychological tests? Can it be done on multiple days, seeing the child's abilities? Yeah, it can. It depends on whether the child is able to sit, stay, be there, how the child is feeling that day. So which is why these assessments do take some time sometimes. But it need not be done at one shot. It can be broken up into bits. What is behavior modification of repetitive behavior? It depends on the child. You have to talk to the person you're working with, the therapist you have with you, so that you all can together decide what would work for your child. How to get into BCaBA course? There is one right now in India. It is in Bangalore. You'll have to, if you just go online, you will be able to look at it. It's an online course, but there are also many courses abroad as well. So if you just look into it, as long as you have a master's or a bachelor's in psychology or a related field, you can do the course. I'm supporting a patient. I'm supporting a parent of an adult with ASD. Has less communication skills and is now showing other behavioral issues. What will be your suggestion to start basic communication skills? As of now, she has around 50 words of receptive communication. Okay. You really need to also, I'm guessing that you are a therapist or somebody that is working with the family. It depends on the person, the child. the adult here in this situation. Oh, you're a parent. Okay. Uh, okay. The point is that it depends on the person you're working with. If she has receptive which communication, which means that she's able to understand about up to 50 words when told to her, then you might start with PEX, which is a picture exchange program. You might, there are so many things that you might do. You will have to work depending on the child you're working with. As vocational part, what kind of techniques to use for an adult? Durga, I will not be able to answer this question because it is such a vast topic. It really depends on the adult that you're working with. Who can study applied psychology? How and from where? Okay.
Applied psychology.
Yeah. How can you study it?
It's a master's school.
So applied, if you're looking at what Renuka did, applied psychology, she's done her master's. So you'd have to do your master's, I guess, in order for you to be able to learn that. Okay. Is IQ test really helpful? Kindly guide. Renuka, you want to answer?
It depends on what you're trying to understand about the child. Right? If IQ then plays a role in us better understanding of the child's abilities, the child's potential areas of lag, then yes, definitely. But yeah, any test you first need to evaluate why you're trying to understand and study it, and what that would mean for the child, and what would that mean for us moving ahead with the child's goals.
So yes, IQ test can be helpful, but it depends on whether it is required for the child or the adult you're working with. So how is it going to help you understand whether the child is able to do a particular type of thing? What kind of intelligence is helping, not helping? So an IQ test is definitely helpful, but depends on whether it is required for that child. Where do you purchase these tests? You purchase them online. Which assessment is useful for potential? For potential, actually, I'm not sure.
Potential for what?
Just general potential, I think that's what it means. Yeah, I don't know of any such test. If you're looking
to understand the question either properly.
Yeah, I'm not completely understanding your question, so can't answer that. Sushma, sorry. What is the right age for a child to perform these tests? I am told that below 3 years of a child can't be labeled as autistic. Is that true?
It depends.
It depends. So, what is the right age for a child to perform these tests? It depends on whether you're seeing lags or deficits in the child as they're growing up. So when you see those lags is when you should go in for assessment, especially if the child's functioning is being affected by lags that are being seen. About whether a child can be labeled as autistic at 3 years of age, it depends on uh, basically on whether the criteria for diagnosis is being able to be easily seen. Autism is such a spectrum. It is sometimes misdiagnosed, and therefore people are careful in order to not diagnose unless the characteristics are really stark that you can really see. Do you want to add anything, Renuka? Yeah, so
That's about it.
yeah. Which test can be used by a special educator? Uh, I am not sure about this answer. I'm sorry. You will have to check with somebody who is a special educator.
Specifically depends more about your awareness about and interest in the children with autism to be able to pick up those signs as well. So even if a person is completely educated, you need to spend enough time around.
So Renuka says that it depends on whether you have the experience and have spent time with working with children with autism, because picking up the signs for autism is not always easy. So it also depends on that. Yeah. I think Cables is available on Amazon, but you'll have to check, Priyanka. I'm sure VBMap is. I'm not sure about Cables. Thank you. DAASI and Mchat are same. Are they the same, Renuka? I'm not sure. Can you check DAASI and Mchat? We'll get back to you on that.
I'll get back to it.
Can you share the link where VBMap is being taught? I'll have to look for it. I don't have time at the moment. Can we use Raven? I'm sure. Sorry, Leila, will you be? I think you can. If you look online, you will find it. It was easily found by me. I don't have the link right now. I'll have to go and look for it. So I can't do it at the moment. So sorry. Renuka, this is for you. Can we use Raven with child or adult with autism?
It has been used. It's a performance-based test, so it has been used. But again, we need to be very careful while using it, especially understanding why we are using it.
So it can be used, but we have to be very careful when using it, especially because why we're using it. How do you manage?
We need to understand why we're using it.
You need to understand why you're using it. How do you manage aggression in ASD? Depends on the function of the aggression. So that's why it's so important to understand whether it's a sensory function, whether it is an escape for attention or for a tangible. And according to whether what the reason or the function of the behavior is, that's how you will manage it. Can you show the slide of FBA? Yes, I can. There it is. Do you conduct courses on understanding and working with autism? Yes, that is something that we are going to be doing in the future. So, yeah.
Check our website.
Yes, check our website. It's trijog.com. TRIJOG. We are based out of Mumbai.
Pavai.
In Pavai, yes, in Pavai, Mumbai. Okay. What is the full form of GARS?
Gilliam's Autism Rating Scale.
Gillian's Autism Rating Scale. How do you distinguish between autism and Asperger's? According to DSM.
So,
yeah, Renuka.
Sorry, yeah, continue.
So according to DSM, it is all now been put under the same umbrella. There is no two separate things. But
yeah, but typically, if you want to have a distinction between the two, it has a lot to do with speech. First ranker would be there should be no developmental delay in the ability to speak. That would be speech is something that develops along with it. And, have good language skills, but again, pragmatic language is something that we are not able to understand. So it's a lot dependent upon their ability for communication. But again, now the autism spectrum in itself has come through a lot of transition throughout all the DSM, right? And I'm pretty sure that they're still trying to understand how Asperger's, Rett syndrome fit into the dynamic.
So speech is a big factor, but they're still trying to figure out how, with the way that the DSM is evolving. DSM is the Diagnostic Statistical Manual, which basically tells us all the disorders that are there in the world. But in India, we have the ICD, and but we also have the DSM, which we kind of look at because that's what's used worldwide. But anyway, so Asperger's at the moment is not like separated in the world. Okay. Role of medicines can be important because it could be used to manage aggression, it could be used to manage stereotypy, it could be used to manage hyperactivity, but you'll need to go to a doctor and use it carefully by understanding, and the doses will have to be monitored and changed depending on your child. Our STEM therapy is a solution. It is not an evidence based practice. STEM therapy is not something that has been, there's no real evidence for any change for that. So I would say no, it's not a solution. These assessments should not be done informally. They should be done formally because it's very, very important to understand where the child is at. And so these assessments are important. So if we do it informally, we're not going to get the correct answers. We're not going to be able to understand where the child actually stands, and therefore we are not going to be able to intervene in the right way. So it must be done formally. Mchat and CARS should be done by a SLP or a psychologist. Psychologist. SLP is a speech and learning pathologist. It should be done by a psychologist. ABC is very efficient. It can be used to help identify the behavior, what is the reason before, what is the antecedent, and what is the consequence of it, and therefore understand how a particular behavior is being reinforced. So an ABC is also conducted while intervention is going on, so it can be very efficient. Is the Indian scale of autism assessment not valid? It is valid. It is very valid. I'm sorry, Renuka, I can't hear you. No, I can't hear you. Please call back. You're muted. Oh, okay. Anyway, Renuka will be back and will explain the ISA. Is there any website where you can get more information about assessments? There are lots of websites. You'll have to really search and understand. Ma'am, we face problem in real life rather than book or article. Real life, totally different. So a lot of these books and articles are based on real life. It doesn't, of course, it is unable to like maybe understand or reach you in the way because you're dealing with it absolutely in real life. But a lot of the things that we learn from that can be applied to our lives to make it better. You might not be able to understand what you're going through from a book, but at least you can use that in order to get better. Okay. All right. I think there are a lot more questions. Yeah, I think.
Am I audible now?
Yes, you're audible. Okay. So can we let's end this with
Am I audible now?
Yes.
I can't hear you, Revati.
Yes, you're audible. I can hear you.
I can't hear you.
Okay. Okay. Can you hear me?
Yes, much better. Tell me.
Are you going to? Did you read on the ISA valid? It is valid, right?
It is extremely valid. It's a brilliant test. The only reason, it's really well done. It's very well used, and it's a brilliant test.
Okay. All right, I think we should. There are a few more. Okay, thank you for your valuable information. Good luck. Thank you, Akriti. Sorry, you have to leave. I understand. Uh, can we get this presentation on mail? I'm not sure what the procedure is.
The recording will be available, I think, on the site.
The recording will be available on the site, so that will be given to you all. Yeah, autism is not. There's no cure for autism. That's something that I would stick by. It depends again from who you're listening to, who you're talking to. But a child, through a lot of therapy, can help get to a functioning that they can function well in society and function independently. It depends on so many factors, unfortunately, that I can't say that every child will. That will be every child's journey. But I would not say that there's a cure for autism. Okay, I think we are going to have to end now. There's a lot of questions uh, that are similar to the others. Um, okay, Renuka, is there a way that we're supposed to be signing out? Yes, we do work with occupational therapists as well. Neetu, we do because it's extremely important to work as a team. Only behavior therapists, only speech therapists, or only occupational therapists do not work well. You have to work as a team in order to help the child or adult that you're working with because it is an overall process. So, yeah. Thank you so much for listening to us and asking us so many questions. I'm sorry we won't be able to answer all of your questions and we'll need to end now. Uh, thank you.